Hey, Dr. Jeff Williams here. I wrote a blog not too long ago titled Debunked, the odd myth that chiropractors cause strokes. And it got so much push that I thought, well, hey, some people don't like to read, so let's record a video that has the exact same information, just in a different form. So that's what I'm bringing to you today. We're going to call this video Debunked, the odd myth that chiropractors cause strokes. I hope you enjoy it. So the whole point is tackling a myth that's run rampant for years, and I hope to once and for all dispel this myth. The myth that chiropractors cause strokes. Now, the information could not be clearer on this, and we're going to show it to you in a way that I hope you can understand, and a way that allows you to show it to others. I'm done with this chiropractors cause strokes myth, folks. I'm done with it. Unfortunately, you've often read, watched, or heard me complaining about how our profession has been historically attacked by those organizations in charge of the medical profession, also known as the medical kingdom. And I hope those paying attention, they understand the fact that this is not just sour grapes, it's education. It's been proven in the courts that medical associations and organizations all align together to force chiropractic out of business and off the face of the planet. When we talk about profession validation, then the history of our invalidation is incredibly important, and I hope you know that. I continually bring these facts up in my articles, videos, and on the Chiropractic Forward podcast that I host, because many of the things that we talk about, they have their roots in history, in the attacks our profession has sustained, and in the attacks our profession is currently battling. From the start, let me please state that research simply does not support this myth. Through the Rand Institute, it's estimated that a serious adverse reaction, something like a stroke as a result of a chiropractic adjustment, that only happens maybe 1 out of every 1 million or so treatments. And keep in mind the 1 out of every 1 to 2 million number. Keep that in mind as we go through this video, okay? Now, let's put that finding into some sort of perspective. We're going to put it into perspective by comparing it to some other common odds that may make sense to you. For instance, the odds of being struck and killed by lightning is 1 in 174,426, according to the National Safety Council. That's pretty long odds, right? The odds of being told to come on down on The Price is Right, that's 1 in 36, folks. 1 in 36. The odds of being born with 11 fingers or toes, 1 in 500. Remember, 1 in 1 to 2 million, 11 fingers, 1 in 500. The odds of dying from a firearms assault is 1 in 113. Now, how about this one? I thought this was just amazing. The odds of winning an Oscar, most of us think that could never ever happen in our lifetime, correct? Not so. The odds of winning an Oscar are 1 in 11,500. Looks like it's time to move to LA, huh? Let's pack up the truck and move to Beverly, folks. I mean, come on. So 1 in 1 to 2 million for a chiropractic stroke, 1 in 11,500 to win an Oscar. The simple message here is that there is very little to zero risk at all of a chiropractic adjustment being the lone cause of a person having suffered a stroke. Plain and simple. If doctors of chiropractic were out in the world causing strokes all the time, it'd be apparent, right? It'd be obvious. And our malpractice insurance would reflect the fact that a visit to the chiropractor comes with a considerable amount of risk. But on the contrary, we chiropractors have malpractice insurance that costs chiropractors approximately 1/10 of what it costs our medical counterparts. Now, before we start diving off into the research too deeply, I want to talk about a case that happened within just the last couple of years, back in February of 2016 to be specific. And this case really brought the whole chiropractors cause strokes myth back to the forefront. And it had to do with the queen of Snapchat, Katie May. Now, Katie died of a stroke at the age of 34. And by many, it was immediately assumed the stroke was a result of her 2 visits to a chiropractor in order to treat her recent onset of neck pain. Now, I actually wrote about this case shortly right after it happened, and I even had a video on it that's still up. And the initial report stated that she had a horrible fall while she was on the set of a photo shoot. And that fall resulted in this neck pain. Then, for some reason, the whole fact that she had this fall just kind of seemed to disappear from the subsequent reports that came out on the matter. In addition, initial reports stated that Katie visited either the emergency room or visited a medical professional prior to her visits with the chiropractor. Now, the family later has denied this, so admittedly, there's some confusion on the matter. And certainly there's confusion when you consider that her family's now suing the chiropractor. But with this information brought back into the reporting, let's begin to break it all down a little bit, okay? Katie posted this message to Twitter, open quote, "Pinched a nerve in my neck on a photo shoot and got adjusted this morning. It really hurts. Any home remedies suggestions, loves? XOXO," close quote. Now, keep that in mind as we run through things that can cause a vertebral artery dissection or the beginnings of a stroke like Katie May suffered. Now, here are some of the things that cause it. Number one, it's kind of a biggie here, physical trauma, such as a direct blow to the neck, a traffic collision, something of that nature. Number 2, strangulation. We know that didn't happen. And number 3, spontaneous from underlying connective tissue disorders. So, according to a paper by Debunked et al., open quote, "Trauma has been reported to have occurred within a month of dissection, vertebral artery dissection, in 40%, with nearly 90% of this time the trauma being minor." Vertebral artery dissection can be particularly difficult to diagnose without the use of a CT angiogram or an MRI. For instance, some common symptoms of a vertebral artery dissection are as follows: pain and/or numbness in the same side of the face, head pain or a headache that develops gradually and can be dull or throbbing. In less than 1/5 of the cases of vertebral artery dissection, people suffer difficulty speaking or swallowing. They may have possible unsteadiness or lack of coordination. They may have visual abnormalities. They may have hiccups. They could have nausea or vomiting. And finally, they may suffer hearing loss. Now, when one reads this list, it seems pretty easy to diagnose a vertebral artery dissection, right? I mean, those aren't all very common. But here's the problem. The problem lies in the fact that vertebral artery dissections rarely present with any of these signs. A vertebral artery dissection commonly presents as a healthy patient that shows up with a headache or neck pain, sometimes both. And in fact, it's estimated that more than 80% of vertebral artery dissection cases present with neck pain and headache alone. And that's it, headache and neck pain. Is a medical professional or a chiropractor they're going to refer every single one of these headache and neck pain patients for a CT angiogram or an MRI? Not very likely. It's just not economically feasible to do so. And even if it were, good luck getting insurance companies to cover the costs on all of those CT angiograms and MRIs. It ain't happening. So if Katie did indeed visit a medical professional after her fall, they missed it. Unfortunately, it seems like the chiropractor missed it as well. That doesn't, however, mean the two professionals are inept. As the website for emedicine.com states, open quote, the focal signs may not appear until after a latent period lasting as long as 3 days. However, and delays of weeks and years also have been reported. Delays of weeks and years for vertebral artery dissection. They can show up with a headache and neck pain. We see this stuff all the time, every day, folks. A study that we'll discuss later shows that people commonly present to a chiropractor or a primary practitioner, medical doctor, already suffering from an artery dissection, a vertebral artery dissection, before they even walked into their offices. But they assumed that the pain they were experiencing was a result of something pretty innocent and pretty simple. Now, with all that being said, I don't want to be completely biased here. If a healthy person shows up with a headache and neck pain, but has a history of recent trauma, I believe more exploration is advised without question. Knowing this, I can relay countless stories of medical doctors having made bad decisions as well. I've heard countless stories throughout my 20 years of practice here. A study that we'll discuss later shows that people commonly present to a chiropractor or medical doctor already suffering the artery dissection before they even walked in the office, just like we said. And this is exactly why chiropractors and medical doctors both carry malpractice insurance. But as I mentioned before, chiropractors' malpractice insurance is about 1/10 the cost of the medical malpractice. Because, listen, basically, we chiropractors don't typically cause harms in our patients. Plain and simple. Trust me on this. The insurance companies know their numbers. If there were considerable risk in going to chiropractors, our malpractice would absolutely reflect that fact, and you can count on that. Now, as we go through more and more papers, it should be clear that Katie likely suffered the vertebral artery dissection as a result of the fall during the photo shoot, and the vertebral artery dissection was missed by the medical professionals, if she did indeed go, and then certainly missed by the chiropractor. But the chiropractor almost certainly did not cause the vertebral artery dissection. There's no way he helped it, and he could have maybe even potentially exacerbated it, but it is highly doubtful and exceedingly rare that he could have been the lone cause of it. Sometime later, the Los Angeles coroner reported that the chiropractor was the one responsible for Katie's death. The only reason she died was because of the chiropractor. This finding really kicked it wide open to all of the chiropractic haters to start bashing away at the profession. And, all of a sudden, here we go, chiropractors cause strokes, right? Well, the LA coroner's office is an appointed position. In some states, it requires little training, to be quite honest. And while I'm unaware of this particular coroner's level of training and expertise, this coroner has been under scrutiny for being understaffed and being underfunded, to mention just a couple of the issues. Now, in addition, I would argue that simply because a man or a woman is a county coroner does not mean that that person is above being affected by bias or by their professionals' long-held beliefs, teachings, and dogma. I would say they most certainly are not above influence and, in my opinion, are actually highly likely to be affected by them. And as I mentioned, the American Medical Association did mount a serious attack to wipe chiropractic off of the face of the planet through misinformation and foolish attacks. I would also argue that the coroner likely has little to zero knowledge of the current body of research regarding cervical manipulation and the instance of stroke as a result. Now, how could an educated person, aware of the body of literature on the matter, make a definitive judgment like he did otherwise? Now, for years, I've experienced nurses, physician assistants, medical doctors, and others in an online setting claiming that chiropractic adjustments are dangerous and ineffective. They claim that commonly chiropractors cause strokes. A theme I always see is, it happens all the time. We see it all the time. And research proves that that notion is quite simply a lie. Or, at minimum, it is ignorance and misunderstanding of their experiences. To put it in plain and simple terms, these detractors wonder why someone would undergo a treatment that is so dangerous, in their opinion, for absolutely no improvement, in their opinion. Now, that is their understanding, that is their opinion, of course. Again, this just shows ignorance in regards to the available research. I'd like to be less dramatic, less inflammatory on this deal, but I don't know of any other way to describe it. Now, let's assume for a moment that this chiropractors cause strokes myth has its base rooted in some sort of fact. Let's be clear, it doesn't. But for argument's sake, let's say that it does. At that point, we'd need to assess the benefits of chiropractic treatment versus the risks of chiropractic treatment, right? In Southern terms, is the squeeze worth the push? Is there a return on the investment? Now again, this is purely for argument's sake. We know it's a myth. It's not real to start with, but playing the devil's advocate can be of use and is almost always entertaining. Before we step into deeper waters with the research papers, let's just discuss benefits and effectiveness versus risk for some common treatments for spinal complaints in the medical world, okay? If the discussion is focused on doing away with cervical adjustments, what then would the alternatives be and how effective would they be, okay? So let's discuss some medical world stuff. Basically, if the medical field is looking into our backyard, maybe we could take a peek into theirs as well, right? It's only fair. Now keep in mind that all the research we discuss is cited in the reference section. I'll leave a link so that you can find all of it that you want, and I really do hope that you go and review these papers independently on your own. The opioid crisis cost the U.S. economy $504 billion in 2015, and a total of $221 billion to $431 billion in lost economic output due to there being 33,000 opioid-related deaths in 2015. Doesn't get any better as we go here, folks. Buckle your seatbelts. There were 63,600 opioid-related deaths in 2016, which was an increase of 21% from 2015. Well, let's get into a research paper. This one is by R. Chow. He concluded, although the steroid injections for radiculopathy showed some short-term relief in pain and short-term increase in function, the benefits seen in the patient were only small and short-term only. There was no effect long-term, no effect on whether or not the person had surgery eventually. The evidence in this paper suggested that there was no effectiveness at all for the treatment of spinal stenosis. Wow. The medical world's not doing so good so far with treating this neck pain. Okay, Epstein et al. Open quote. Although not approved by the Food and Drug Administration, injections are being performed with an increased frequency of 160%. They're typically short-acting and ineffective over the long term, while exposing patients to major risk complications. End quote. Ooh, not looking so good. C.K. Peterson et al. Open quote. Subacute and chronic patients treated with spinal manipulative therapy were significantly more likely to report relative improvement compared with cervical nerve root injection patients. There was no difference in outcomes when comparing acute patients only. Another one by R. Chow. Open quote, epidural corticosteroid injections for radiculopathy were associated with immediate improvements in pain and might be associated with immediate improvements in function, but benefits were small and not sustained, and there was no effect on long-term risk of surgery. Evidence did not suggest that effectiveness varies based on injection technique, corticosteroid dose, or comparator. Limited evidence suggests that epidural corticosteroid injections are not effective for spinal stenosis or non-radicular back pain, and that facet joint corticosteroid injections are not effective for presumed facet joint pain, end quote. Another one by R. Chow et al., open quote, surgery for radiculopathy with herniated lumbar disc and symptomatic spinal stenosis is associated with short-term benefits compared to non-surgical therapy, though the benefits diminish with long-term follow-up in some trials. For non-radicular back pain with common degenerative changes, fusion is no more effective than intensive rehab, but associated with small to moderate benefits compared to standard non-surgical therapy, end quote. Here's another by Maghout et al., open quote, use of intervertebral fusion devices rose rapidly after their introduction in 1996. This increased use was associated with an increased complication risk without improving disability or reoperation rates, end quote. Look, at this point, it's clear the medical field has its own issues to concentrate on and improve upon when it comes to spinal pain and the treatment of it. The biggest yoke they try to put on our necks is the chiropractors cause strokes myth. And considering the research, their concerns maybe should be focused in their own playground. Now, let us begin a risk versus reward discussion with the benefits of cervical manipulative therapy. If we talk about danger with an intervention, then we have to talk about the risk versus reward ratio. And I want to start it off with the benefits of cervical manipulation. This is for neck pain specifically. Each paper mentioned includes a short description of the conclusion for each paper cited. Again, I'll leave a link for all of this so that you can review it independently. Okay, so let's get started. Corthalis de Bose, great name. Open quote, manual therapy, also known as spinal mobilization, is more effective and less costly for treating neck pain than physiotherapy or care by a general practitioner, end quote. Physiotherapy is another name for physical therapy, folks. Next one, DeWitt et al., open quote, based on key features in subjective and clinical examination, patients with mechanical nociceptive pain probably arising from articular structures can be categorized into specific articular dysfunction patterns. Depending on these patterns, specific mobilization and manipulation techniques are warranted. The proposed patterns are illustrated in 3 case studies. This clinical algorithm is the corollary of empirical expertise and is complemented by in-depth discussions and knowledge exchange with international colleagues. Consequently, it is intended that a carefully targeted approach contributes to an increase in specificity and safety in the use of cervical mobilizations and manipulation techniques as valuable adjuncts to other manual therapy modalities, end quote. Now, Dunning et al., open quote, the combination of upper cervical and upper thoracic high velocity, low amplitude thrust manipulation is appreciably more effective in the short term than non-thrust mobilization in patients with mechanical neck pain, end quote. Bromford et al., open quote, for participants with acute and subacute neck pain, spinal manipulative therapy was more effective than medications in both the short and long term. However, a few instructional sessions of home exercise resulted in similar outcomes at most time points. Puentura et al., the objective of the paper was as follows. Thrust manipulation to the cervical spine has been shown to be effective in patients presenting with a primary report of neck pain. It would be useful for clinicians to have a decision-making tool such as a clinical prediction rule that could accurately identify which subgroup of patients would respond positively to cervical thrust joint manipulation. In the results of this paper, they showed if 3 or more of the 4 attributes were present, the probability of experiencing a successful outcome improved from 39% to 90%. Now, you et al., open quote, Chiropractic management of atlantoaxial osteoarthritis yielded favorable outcomes for these 10 patients, end quote. Next paper, Puedentura again. Open quote, patients with neck pain who met 4 of 6 of the CPR criteria for successful treatment of neck pain with a thoracic spine thrust joint manipulation demonstrated a more favorable response when the thrust joint manipulation was directed to the cervical spine rather than to the thoracic spine. Patients receiving cervical thrust joint manipulation also demonstrated fewer transient side effects, end quote. Miller et al., open quote, moderate quality evidence supports this treatment combination, which is cervical manual therapy combined with exercise, for pain reduction and improved quality of life over manual therapy alone for chronic neck pain. And it suggests greater short-term pain reduction when compared to traditional care for acute whiplash, end quote. Next paper, Hurwitz et al., open quote, our best evidence synthesis suggests that therapies involving manual therapy and exercise are more effective than alternative strategies for patients with neck pain, end quote. Next paper, Muller et al., open quote, in patients with chronic spinal pain syndromes, spinal manipulation, if not contraindicated, may be the only treatment modality of the assessed regimens that provides broad and significant long-term benefit, end quote. Zhu et al., open quote, there was moderate level evidence to support the immediate effectiveness of cervical spine manipulation in treating people with cervical radiculopathy. And Giles et al., open quote, the consistency of the results provides, despite some discussed shortcomings of this study, evidence that in patients with chronic spine pain, manipulation, if not contraindicated, results in greater short-term improvement than acupuncture or medication, end quote. Braunfurt again et al., open quote, our data synthesis suggests that recommendations can be made with some confidence regarding the use of spinal manipulative therapy and or mobilization as a viable option for the treatment of both low back pain and neck pain, end quote. So there you have a fairly thick list of research papers demonstrating the effectiveness of chiropractic adjustments for uncomplicated neck pain. But neck pain is not the only reason that we have chiropractic adjustments delivered to the cervical region, am I right? Another very common reason for neck adjustments would be for the treatment of acute and chronic headaches. Chiropractors see headache patients in their offices daily, and research shows us those patients are in the right place for the best non-pharmacological treatment of that complaint. In fact, I have an episode of this Chiropractic Forward podcast. You can go to chiropracticforward.com that deals with a paper showing the effectiveness of chiropractic for headaches. It is episode number 6, and I will link it in the video description. So here's a listing of papers demonstrating the benefits of cervical manipulation for headaches. Again, you'll find the link to the papers so that you can independently review them, and I hope that you do. Let's start with Mallourius. Open quote, cervical translatoric spinal mobilization intervention, which is also chiropractic adjustment, but it's physical therapists doing it, so they changed the name of it. But translatoric spinal mobilization is a chiropractic adjustment, make no mistake. So let's start over. Open quote, upper cervical translatoric spinal mobilization intervention increased upper and exhibited a tendency to improve general cervical range of motion and induce immediate headache relief in subjects with cervicogenic headache, end quote. Next paper, Espy-Lopez et al., open quote, in short, manual therapy techniques and manipulation applied to the suboccipital region for 4 weeks or more showed great improvement and in effectiveness for several aspects that measure the quality of life of a patient having suffered from tension-type headaches, end quote. Dunning et al., open quote, 6 to 8 sessions of upper cervical and upper thoracic manipulation were shown to be more effective than mobilization and exercise in patients with cervicogenic headache, and the effects were maintained at 3 months, end quote. Hurwitz et al., open quote, utilization and expenditures for headache treatment increased from 2000 to 2009 across all provider groups. MD care represented the majority of the total allowed charges in this study. MD care and DC care, chiropractors, alone or in combination were overall the least expensive patterns of headache care. Risk-adjusted charges were significantly less for DC-only care, chiropractors-only care. Bromford et al., open quote, spinal manipulative therapy appears to have a better effect than massage for cervicogenic headache. It also appears that spinal manipulative treatment has an effect comparable to commonly used first-line prophylactic prescription medications for tension-type headache and migraine headache, end quote. Another one by Bromford, open quote, chiropractic is effective in acute, subacute, and chronic low back pain, migraines, and headaches originating from the neck for the treatment of some forms of dizziness, extremity, and joint issues, as well as mid-back and acute and subacute neck pain. Tuchin et al., open quote, the results of this study support previous results showing that some people report significant improvement in migraines after chiropractic spinal manipulative therapy. A high percentage, greater than 80% of participants, reported stress as a major factor for their migraines. It appears probable that chiropractic care has an effect on the physical conditions related to stress, and that in these people the effects of the migraines are reduced. McCrory et al., open quote, cervical spine manipulation was associated with improvement in headache outcomes in 2 trials involving patients with neck pain and or neck dysfunction and headache. Manipulation appeared to result in immediate improvement in headache severity when used to treat episodes of cervicogenic headache when compared with an attention placebo control. And furthermore, when compared to soft tissue therapies like massage, a course of manipulation treatments resulted in sustained improvements in headache frequency and severity, end quote. Many headache patients present to chiropractors after a considerable amount of time spent taking headache and migraine medications. Chiropractors know this. Medications do not come without consequences, certainly when taken long-term. Not only have these patients spent a considerable amount of time on medication, they often have endured things like Botox injections, steroid injections, and worse, before finally going to a chiropractor. It is a fact that patients should have the guarantee of the best treatment that does the least amount of harm. That's chiropractic. In that spirit, and considering that chiropractic is safe, effective, and non-pharmacologic, it makes sense that the medical field should actually promote chiropractic as a viable, if not valuable, treatment for headaches and migraines, rather than dismiss it as ineffectual and dangerous. Having demonstrated study upon study validating the effectiveness and the benefits of cervical manipulation for neck pain, acute, subacute, and chronic, as well as the benefits and effectiveness of cervical manipulation for headaches, chronic, acute, subacute, tension type, cervicogenic, and migraines, I think we can now focus our attention on research papers having to do with the risk of stroke instance, or the lack of, as a direct result of cervical chiropractic adjustments. But first, where would you think the idea of chiropractors causing strokes would come from? I believe there are at least a few root sources we're going to cover. You guessed it, number one, our old friend, the American Medical Association, and their state association underlings. This group deemed it unethical to refer to chiropractors or to accept referrals from chiropractors. Let's throw that Hippocratic oath just straight out the window. They tried to run us out of business by conducting conferences about chiropractic and generating literature that was anti-chiropractic. I'm so honored. They then disperse the information down through the channels of the state medical associations, all the way out to the medical doctors, nurses, and professionals out there in the field, and then ultimately to the patients. The chiropractors cause strokes myth was well within their ability to propagate. When your initiative is to rid the earth of the chiropractic profession, well, you take advantage however you can. The federal court decision in Wilk versus AMA shows the AMA did just that. The other likely culprit, in my estimation, would be patients visiting medical professionals after having been to a chiropractor and having suffered a stroke sometime afterward. I did not say chiropractors causing strokes. Research shows us people going to chiropractors already suffering the tears. We've covered this. Sometimes it's spontaneous in nature and almost impossible to diagnose in an in-office setting. While chiropractors have a high level of education, there are many out there that simply may be untrained at catching red flags and making the proper referral. Other times, patients present with very common symptoms and there's no red flags whatsoever. The chiropractor treats the patient thinking they're going to help improve a neck complaint or a headache, while in reality, they might be exacerbating a vertebral artery dissection. But when the patient reaches the medical professional, the link is easy to make for the uninformed medical professional, right? Chiropractors cause strokes. Well, it's just not the fact. Another culprit, ignorance. The simple lack of knowledge regarding the body of evidence and research that is available on the topic perpetuates this myth. It's clear the benefits are present. It's clear the risks are not. End of story. That's it. But if one is ignorant of the literature, then chiropractors cause strokes is definitely plausible, if not likely, in their minds. And I find it interesting and helpful to relate ideas in medical terms. Many times when we're learning about topics that we're unfamiliar with, it helps to familiarize the material by relating it in terms that maybe we can better understand. Have you ever watched a commercial for a new medicine or a pill, and at the end of the commercial, the narrator runs through an obstacle course of side effects and possible harms? It'll scare the hell out of you. If you've seen those commercials, it's crystal clear that prescription medication can be scary and risky. But what about more benign, kind of over-the-counter medications? Well, briefly, let's discuss some of the other treatments and risks patients commonly face with traditional medical interventions. Data obtained from the U.S. Centers for Disease Control and Prevention shows that more than 300 people die every year as a result of acetaminophen poisoning. Beginning in 2006, according to the CDC, the number of people who died after accidentally taking too much acetaminophen surpassed the number who died from intentionally overdosing to commit suicide on purpose. NSAIDs such as ibuprofen and acetaminophen cause at least 16,000 deaths per year and send 100,000 people to the emergency room in the United States each year. It's clear that there's risk with any sort of intervention when it comes to the living, breathing, constantly changing human body. There's risk when somebody chooses to cross the street, folks. When you choose to walk in a rainstorm, or if you decide to climb a ladder. It's risky. It happens. That's life. Most of us don't let these minimal risks control our decisions or instill fear into our hearts so that we refuse to take an action or live our lives. The majority of the population subconsciously realizes a risk, understands minimal odds, and takes action accordingly. What follows is a listing of the papers exploring the risks of adverse events as a result of a cervical manipulation. Cassidy et al., spanning over a 9-year time period, 109,020,875 person years. The researchers included visits to chiropractors and primary practitioners, and there was no statistical difference between the likelihood of vertebral artery dissection after seeing a primary medical doctor versus after having seen a chiropractor. The only possible conclusions here are, number one, chiropractors and medical doctors are causing strokes on rare occasion. Number two, patients are presenting to the offices of chiropractors and medical doctors seeking relief from symptoms of a vertebral artery dissection already in progress. Obviously, the medical professionals are not manipulating the cervical region, so option number one doesn't make any sense. Cassidy's paper conclusion was as follows, open quote, "This suggests that patients with undiagnosed vertebral artery dissection are seeking clinical care for headache and neck pain before having a vertebral basilar artery stroke." So Cassidy, Promfert, Hartvigsen et al. And this article appeared in the British Medical Journal in 2012. Open quote, "The effectiveness of manipulation for neck pain has been examined in several high-quality, systematic reviews, evidence-based clinical guidelines, and health technology assessment reports. When combined with recent randomized trial results, this evidence supports including manipulation as a treatment option for neck pain." British Medical Journal. "We say no to abandoning manipulation and yes to more rigorous research on the benefits and harms of this and other common interventions for the neck pain." End quote. Next paper, Kozlov et al. Open quote, "We found no significant association between exposure to chiropractic care and the risk of vertebral basilar artery system stroke. We conclude that manipulation is an unlikely cause of VBA stroke. The positive association between the primary care provider visits and the VBA stroke is most likely due to patient decisions to seek care for the symptoms, like headache and neck pain, of arterial dissection. We further conclude that using chiropractic visits as a measure of exposure to manipulation may result in unreliable estimates of the strength of association with the occurrence of VBA stroke." End quote. Next paper, Buzzati, open quote, "The displacement induced with the present technique seems not to be able to endanger vital structures of the spinal cord and the vertebral artery. This study also adds to a better comprehension of the kinematic of the atlantoaxial segment during the performance of a high-velocity, low-amplitude manipulation." End quote. Next paper, Whedon et al. Open quote, "Among Medicare B beneficiaries aged 66 to 99 years old with neck pain, incidence of vertebral basilar stroke was extremely low. Small differences in risk between patients who saw a chiropractor and those who saw a primary care physician are probably not clinically significant." End quote. Achelandabasso et al. Great name. Open quote, "Our data showed no changes in any of the studied damage markers. Although this study examined the outcomes in an asymptomatic population, lower cervical and thoracic manipulative techniques seem to be safe manual therapies techniques which cause no harm to the health of the subject. These data may be used as evidence of the safe application of spinal manipulation to healthy subjects. Further studies with a large sample size and a patient population are needed to corroborate the innocuous effects of spinal manipulation." End quote. Quesnel, open quote, "There were no significant changes in blood flow or velocity in the vertebral arteries of healthy young male adults after various head positions and cervical spine manipulations." End quote. Tuchin et al. Open quote, "The evidence for causality of vertebral artery dissection from chiropractic is weak." End quote. Next paper, Simons et al. Open quote, "We conclude that under normal circumstances, a single typical high-velocity, low-amplitude spinal manipulative thrust is very unlikely to mechanically disrupt the vertebral artery." End quote. Next paper, Church et al. Open quote, "Our analysis shows a small association between chiropractic neck manipulation and cervical artery dissection. This relationship may be explained by the high risk of bias and confounding in the available studies, and in particular by the known association of neck pain with cervical artery dissection and with chiropractic manipulation. There's no convincing evidence to support a causal link between chiropractic manipulation and CAD. Belief in a causal link may have significant negative consequences, such as numerous episodes of litigation. End quote. A methodical, logical, and systematic stroll through the body of literature shows without a doubt there is indeed incredible benefit in the use of the cervical manipulative treatments for neck pain, for headaches, and migraine complaints, while there's no more risk of stroke from treating with a chiropractor versus treating with a medical professional. I just showed it all to you. I want this video to be the final word on this chiropractic stroke myth. I want it to be the end-all, be-all on this topic, but I've lived long enough. I know better. And I've experienced 20 years within the chiropractic profession. I know this information. It's not going to change the attitudes of many. But if this video can be a reference point for learning more about the topic and can be a tool for educating others about this myth, then I've done my job. In conclusion, I gotta say, the benefit and the effectiveness has been proven. The risks have been disproven, and the chiropractors cause strokes myth is once and for all officially and completely debunked. If you continue to run across people that try to propagate this myth, then you are looking at someone who is equal to a flat earther at this point. Again, I'm Dr. Jeff Williams, host of Chiropractic Forward, owner of Creekstone. Thanks for watching. Be sure to find me on social media sites such as Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, Instagram, and YouTube. While you're at it, give us a thumbs up on YouTube. That's super simple. Be sure and visit chiropracticforward.com. Give our podcast a listen. Lots of wonderful, wonderful information there. And as always, thanks for listening. We'll see you next time.